Adrenal gland or the suprarenal gland, also called as the gland of emergency. The paired structures are located on the top of the kidneys. Adrenal gland have two parts. The first is external adrenal cortex surrounded by the fibrous capsule, and the second is adrenal medulla. As shown in the figure, the glands are present on the top of the kidneys in pairs. Internal part is medulla, whereas the external part is cortex surrounded by the fibrous capsule. Let's discuss adrenal cortex in detail. Origin of the adrenal cortex is derived from the mesoderm of the embryo. Adrenal cortex is differentiated into three zones. The first is zona glomerulosa, the second is zona fasciculata, and the third one is zona reticularis. Here in the diagram, we see the layers of the adrenal gland. The first is outer thick zona glomerulosa, which make up of 15% of the gland. The second is middle thick zona fasciculata, which make up of 50% of the gland. And the third is thin zona reticularis, which make up of 7% of the gland. And they all comprise of the adrenal cortex. The inner part of the adrenal gland comprise of the medulla. Next comes the hormones of adrenal cortex called corticosteroids. They are grouped into three categories. The first come melanocorticoids secreted by the cells of the zona glomerulosa. They release aldosterone, a salt retaining hormone. Here in the diagram, we see that the aldosterone helps in regulating sodium and potassium content of the body. When the sodium level is low, it stimulates kidney to absorb sodium and to secrete potassium into the urine. The next is glucocorticoids, which are released by the cells of the zona fasciculata. It releases mainly three types of hormones. The first one is cortisol. It is most abundant, about 95% among these hormones. Cortisol stimulates liver to synthesize glucose via gluconeogenesis. It stimulates muscles for degradation of proteins. Cortisol reduces bone formation, has anti-insulin effect in the pancreas, and promotes breakdown of fats of the adipose tissues. The next hormone is cortisone. It is a precursor that could be converted into cortisol. Cortisone has half an hour life. The next hormone is corticosterone. It is involved in the regulation of energy, immune reactions, and stress responses. Next subtype is corticosteroids or gonadocorticoids, also called as the sex corticoids, released from the cells of zona reticularis. They are of two types. The first is androgens, male hormones important for the development of male fetus, and the second is female hormones, estrogens, important for the development of female characters. Let's discuss disorders of the adrenal cortex. The first is Adensons disease. It causes due to the deficiency of melanocorticoids and the glucocorticoids. The symptoms are mainly low blood sugar, low sodium, high potassium, vomiting, diarrhea, and the main symptom is bronze-like pigmentation. The picture shows this pigmentation significant system in the patient suffering from this Adensons disease. Second is Cushing syndrome. It causes due to the excess of cortisol due to the tumor of adrenal cortex. Symptoms are high blood sugar, rise in sodium, low potassium, high blood pressure, obesity, wasting of muscles of thighs, pectoral and pelvic girdles. This picture shows obesity, pendulous abdomen, thin arms and legs, stretch marks in patients suffering from this disease. The next disorder is aldosteronism. It is caused by the excessive production of aldosterone from the adrenal cortical tumor. Symptoms are high sodium, low potassium, rise blood volume, high blood pressure. The next disorder is adrenal virilism. It is caused by the excessive secretions of the androgens. Appearance of male characters in the female is called as virilism. The main symptoms are beard, mustache, horse-like voice in women. Next disorder is gynocomastia, caused by the excessive secretions of the estrogens. The main symptoms are enlarged mammary glands in the males. Now let's discuss adrenal medulla, inner part of the gland. Origin is from the neuroectoderm of the embryo. It secretes two hormones. The first is norepinephrine or noradrenaline. It regulates blood pressure, increased activity of heart, inhibition of gastrointestinal tract, dilation of pupils, construction of all blood vessels. The second is epinephrine or adrenaline. It is also called as the emergency hormone. It causes only weak construction of blood vessels, greater metabolic effect, greater effect on the cardiac activity. The target cell of both of these hormones are on the skeletal, cardiac, smooth muscles, blood vessels, and the fat cells. Sympathetico-adrenal system. When sympathetic nervous system and adrenal medulla function as an integrated system, it is called as the sympathetico-adrenal system. This is all about adrenal gland and its hormone in details. Please like, share and subscribe this video. Thank you.